بسم الله الرحمن الرحيم وصلى اللهم على سيدنا محمد وعلى آله وصحبه وسلم أجمعين. Welcome to the Islamic Roots of Mental Health. This is a co-sponsored event by ISNA, Islamic Society of North America, and the Khalil Center, which is a Muslim counseling center that integrates principles of Islamic psychotherapy along with modern psychology. I want to first commend ISNA for taking the initiative to partner with the Khalil Center for Mental Health Awareness Month and for discussing a very important topic in our community that is often neglected and not spoken about much. Inshallah, in today's discussion, we're going to go through some really interesting research and also really dive into history to understand the Islamic roots of mental health. A lot of this work happens, for myself, happens in the Stanford Muslims and Mental Health Lab, which is the lab that's really dedicated for the academic studying of academic home for the study of mental health as it relates to the Islamic faith and Muslim populations. The Stanford Muslims and Mental Health Lab is one of the academic and research partners for the Khalil Center. Here we kind of work on the theoretical, and in the Khalil Center work on the practical aspects of therapy and offering counseling to Muslim populations. Now, in this topic of the roots of mental health, there may be a question as to why we should explore contributions of people that are centuries old, and how is that even relevant to today's discussion of modern psychology or psychiatry. However, as it turns out, we find that there are actually several benefits from this endeavor. One of the most important is that generally Muslims are pretty oblivious as to their rich legacy and heritage of mental health that was brought by their ancestors and noble predecessors, and that these contributions were really largely based in Islam and based on Islamic principles. And because our belief of Aqidah in Islam is that Islam is relevant for all times and all places and all people. That being the case, meaning that the inspiration from Islam to then figure out the understanding of the self and what today we the psyche and today what we call psychology would be really important, because it's very much going to continue to be relevant even for today. Also, we find that the early Muslim scholars who were really some of the people who originated and came up with some of the many psychological theories and practices that are prevalent and relevant even until today. Also, it's important to talk about this because much of the early contributions of our scholars remains wholly untranslated. So a lot of it is in Arabic, some in Farsi, some in Turkish, but the majority of it continues to be untranslated. So therefore, particularly for Muslims who live in the West and whose primary language tends to be English, they may not have really much ability to then go back and to read for themselves and research what's written out there. And if they were to rely solely on the books of psychology, psychiatry of today in the modern era, where very little reference or mention of the Muslim past and Muslim scholarship, and sometimes completely skipped over, whether intentionally or purposefully. And so here we really try to bring together the understanding of this Muslim literature and the contributions of the early Muslims to psychology. Otherwise, it would be very sparse and quite scattered. Also, we find that the early Muslim scholars, wrote extensively on the area of human psychology, even though the term psychology itself did not exist at that time. It's more of a modern term. However, where you find their work is embedded within discussions of philosophy and medical writings. And any student of psychology knows that the origins of psychology originally comes from the discussion of philosophy, and they share a root word there. And the early Muslim scholars often spoke about this term called the nafs, the self or the soul. And it was denoted, and they used it to denote individual personality. They also spoke of the word fitra, or wrote of the word fitra, which they used to explain human nature. They also talked about, and when they talked about the nafs, it had this broad range of topics that discussed the qalb, the heart, the ruh, the spirit, the aql, the intellect, and irada, which is will. These are all terms you find very readily in their writings. And you'll find also that many scholars whom today we would not actually call psychologists per se, but they were these encyclopedic scholars, either directly or even indirectly, contributed to the study of the self because that was a very important concept in Islamic understanding. And you start to find these descriptions of human nature and the self and so on as early as 800 AD, so we're talking the 9th century, and it spans through about the 13th century. So one of the things we're going to do today in our discussion is actually go through scholar by scholar some of the main thought leaders in the field of psychology, what today we would call psychology, and really share with you some of the main things that they came up with, um, ideas and concepts. And for a person who's very interested in psychology, psychiatry, perhaps a student or practitioner of it today, you'll find that these concepts are very relevant, and they remind you of things that you are currently either practicing or reading about today, to the point that you might ask yourself, when was this discussed again? And then you're just amazed that it's, centuries, if not a millennium, before what would be the folks who are today attributed to coming up with these ideas. But again, a lot of that is a factor of not having our original text translated and discussed in the topics, particularly as it relates to modern psychology and psychiatry. So first, let's go to the year 800. 800, Baghdad. Here we have Al-Kindi, who's probably one of the earliest writers on the topic of what today would be called psychology. And Al-Kindi actually writes over 240 books or small texts that relate, and some of them that are related to psychology have titles like On Sleep and Dreams or The Eradication of Sorrow, mashallah. And in Kindi here, when he talks about sorrow or sadness, he says that he defines it as a spiritual, or in Arabic here would be nafsani, grief caused by the loss of a loved one or personal belongings, or by failure in obtaining what you wish for. And then he goes on to say, but if the causes of the pain are discernible, like if you can actually tell what they are, then you can cure it. And he says that the sorrow, which is a very important point here, that sorrow, sadness is not within ourselves, but rather we bring it upon ourselves by these external factors. So here immediately you find someone very early on speaking about the difference between the internal and the external causes of grief or depression. He also he says to combat depression, he discusses cognitive strategies. Probably one of the very first to say this, to use cognitive strategies to figure out how to deal with depression and actually fight it. Again, that term cognitive here, you're going to find again in modern psychology, right? CBT, or cognitive behavioral therapy, right? So the early Muslim thinkers had thought about this and really used this or recommended it to be a form of treatment for things like depression or sorrow. Next up, we have a Tabari. Tabari is also in the 9th century, and he is a Persian Muslim convert, so somebody who had come into Islam and really pioneered what we'd call today the field of child development. And in his book, Firdaus al-Hikam, he basically, and you should see this book, the Firdaus, it's a text that has 7 sections, and it's split into 360 chapters. And what's really wonderful about Tabari, as you find with other Muslim scholars, they were very particular in making sure that making sure that they contributed their findings from other sources. So if it came from the Greeks, they would say so and mention it. But if it came from Indian texts, like here Tabari often would refer to some of the ancient Indian texts and their contributions in relation to medicine and in relation to psychology. And he would say that this is where he was getting some of his thinking from. And one of the most interesting things about Tabari is his emphasis on this need of an importance of psychotherapy, talk therapy, and urging physicians to really be smart and witty to help their patients feel better by basically saying that many times patients will come in feeling sick because of what he called delusive imagination. And the competent, he would say the competent or skillful doctor would be able to treat them sometimes just by wise counseling, essentially like talking through and counseling them through the issue, sometimes in itself was a solution to the problem, interestingly enough. Now we have Abu Zayd al-Balkhi, who's perhaps one of my favorites and someone who I intend to come back to towards the end of the talk today, and share with you a little bit of my own research about him. But Abu Zayd al-Balkhi um, is in the 9th century, uh, and also kind of heading into the 10th century. And al-Balkhi is probably the very first cognitive psychologist, if you will. Interestingly enough, like other scholars and thinkers of early Islamic history, um, he didn't set out to be a psychologist or even a physician. Interestingly enough, a lot of these scholars are encyclopedic scholars. They're meta physicians or meta scholars, right? And what he's in fact most known for is actually geography. The Balkhi School of Geography is probably his most claim to fame. But he had this book, which today is translated now and available by Malik Badri, called The Sustenance of the Body and Soul. And al-Balkhi was really phenomenal because he was able to talk about, well, the body and the soul, which reminds you of this common new age term we use today of what? Mind body medicine, right? And this idea of mind body medicine, right? Taking the cognitive and making sure you can differentiate it from the physical is really important to him. And he probably is one of the very first people to clearly be able to differentiate between what we call neurosis and psychosis, right? Neurology and psychology, even though that they're related, they're different. These are different disorders. And he's also able to really tell us in detail how rational and spiritual cognitive therapies can really help treat each of these different disorders that he classifies. And he has this very complex classification of illnesses, and he puts them, he compartmentalizes them many times correctly, subhanAllah, as early as this is, into proper categories that today the modern clinician would say, oh, that's exactly how we would understand it today. And he looks at emotional disorders into four main categories. He puts together fear and anxiety as one, anger and aggression as two, sadness and depression as a third, and obsessions as a fourth. And he compares the physical and the psychological disorders and shows how they interact. And he's probably one of the first people to understand and really write about the concept of psychosomatic disorders, which essentially are disorders that originate in the psyche, but are psychological, essentially disorders, but manifest physically. So people feel them in the soma or the body. And he has these really great analogies all throughout the book. So, for example, he'll say, just like a healthy person, when you're healthy and you're fine, you still in your medicine cabinet or a cabinet at home keep a first aid kit just in case, right? You get a scrape, a cut, a bruise, or something. You have something to unexpected physical emergency to like help you out. He says, just like you have a physical first aid kit, you should also have an emotional or psychological first aid kit available to help you whenever unhealthy feelings or thoughts come to mind or unexpected emotional outbursts. You should have this first aid kit. MashaAllah. It's a wonderful idea. And so on. He's got these great analogies that he talks about commonly. And where are we? We are in the 9th century here. Al-Balkhi also says that there's a balance between the mind and the body, and whenever they're imbalanced, right, it will cause sickness, which is again a very modern understanding of illness. He also says that depression, when he talks about depression, he kind of classifies it into three different categories. He talks about normal huzn, he uses the word huzn or sadness, which today we would understand as typical depression. Then he talks about endogenous depression and reactive depression. And endogenous here meaning that it originates within the body, while reactive, he says, originates outside of the body. And I think that's really interesting, subhanAllah, that you're able to have the inside and the outside, kind of the understanding of both things. Um, Very early for his time, subhanAllah. Like we said, Al-Balkhi is one of my favorites and certainly one we'll come back to in a little bit. But if we go down the line historically, we next come up to Abu Bakr al-Razi, Ibn Zakaria al-Razi. And Razi also was in the 9th and early 10th century. He's Persian and known by to the West as Razis. And he's also a promoter of psychotherapy, just like his teacher, At-Tabari, who we talked about previously. And Al-Razi, and by the way, there are two Razis in history. We'll talk about them both today, but this is the earlier Razi. And Al-Razi here, he talks about how when doctors are really skilled, physicians are really skilled, they help encourage their patients and make them feel better. And they promote speedier recoveries, right? So he really puts a lot of emphasis on making sure that the physician is well skilled and has the proper bedside manners to really be able to help their patients. And he really himself became this master of prognosis, being able to figure out what the illness is within a person. He was also very skilled in psychosomatic medicine and also in anatomy. And he wrote many a book, many a text. He even has a text on how you measure intelligence. And probably one of his most famous books is Kitab al-Hawi or al-Hawi fi Tib. And it is said that this is the longest work ever written in Islamic medicine. And he was absolutely recognized as a medical authority in the West up until the 18th century. So think about that. The 1900s, they're still quoting Ar-Razi from the what? The 9th century. Subhanallah. So we're talking about some serious contributions and help here and understandings to the beginnings of the field, what would later become the field of psychology. And in his compendium, the Tib, Al-Hawi fi Tib, Razi actually says, and he says there, look, we read the works of the Greeks and other scholars before me. I read them, digested them, looked through them, but I don't actually agree with certain things that Hippocrates or Galen came up with. I actually think it should be like this or like that. So again, very careful to make sure that he explains the works of those who came before him and then elucidate where he differed with them and what he then contributes to medicine. Subhanallah. He has, like I said, many a book. He also has At-Tib al-Mansuri, which talks about the medicinal healing arts. At-Tib al-Rawhani. Here he talks about ways to treat the moral and psychological ills of the human spirit. And he wrote that there are sound medical practices, and these depend on kind of making sure that you are an independent thinker. And you're able to understand that the soul is separate from the brain, right? The mind. The soul is separate from the mind. And the mind is more of the instrument that the soul then you use to help treat the soul. Very super advanced thinking for that time, mashallah. Interestingly enough, on his topic of obsessions, just as a side note, because we'll come to the obsessions later again, but his thinking on that was if they're waswasa or religious compulsions, they can be overcome with reason. And I think that's a very interesting concept because we definitely say the same thing today as it relates to obsessive compulsive disorders or OCD. Next up, we have Al-Farabi. Here we're nearing the end of the 9th century and into the 10th century. And Fakhruddin al-Farabi is Turkish, and his probable most claim to fame is on the topic of social psychology. And he talks about this concept of the model city. And he says how individuals, if they completely isolate themselves, they really cannot reach perfection by themselves. In fact, the human beings were created so that they're essentially in neighborhoods or neighbors with one another. And that is the best way to actually reach a form of perfection with and within other people. So that's kind of an interesting concept on this, again, this topic of social psychology. He also wrote on dreams and made a very clear distinction between dream interpretation and the actual causes of dreams. So those who study psychology and especially early psychology, will find that this is the works of Farabi well predate the works of Freud, for example, right? He also talks about, Farabi also talks about music therapy, what today we would call music therapy, the effects of music on the soul, and how it can actually be therapeutic in nature. And his topics, and his probably where he's most famous as his writings on the metaphysics, and how these really become his crown jewels of his writings, mashallah, what he's most famous for. But certainly has so many gold nuggets, if you will, of help and understanding within the topics of mental health and illness. Now we're in the 10th century, and we're looking here at Al-Majusi, who is Persian, and in his book, Al-Kitab al-Malaki, which is translated as the Royal Notebook. And in it, he talks about, it's really this work of Islamic medicine. And it receives all this fame along, and we're going to talk about Ibn Sina in just a little bit, but the Qanun, or the canon of Ibn Sina, and the Royal Notebook of Al-Majusi are essentially, they go side by side, right through the Middle Ages into modern time. They're used until modern era. And not only is this book so well known that it's translated into Latin once, but it's actually translated twice, and used over and over again. And in it, he writes about really the entire health field, but specifically also about mental illnesses as well. And he describes their anatomy, physiology, diseases of the brain. And then he also talks about things that would be categorized today in the field of psychology, right? And he really talks about preserving health and preventing diseases or illnesses rather than just, and he says, first you should really look at preserving health, right? Preventative causes, and methods of natural healing before you try to give drugs or medicine. And drugs and medicine should come as a last resort. So again, really interesting and kind of very early discussions of this. And he has, like I said, many a book, probably 20 or so on medicine alone, with, hundreds of chapters that cover medicine and mental health related things as well. So you see, we could spend kind of a whole discussion just on him alone, let alone on each and every one of these scholars. Very interesting about him as well, before we end on him and talk about the next scholar, we have here, uh, really interesting about him is he talks about research, and he says research methodology, and this idea that you can really only have good science if there's a research methodology in place. So not too different than what you today would call, what today would be kind of modern science or modern research that we use in our institutions today. But again, we are talking about the 10th century here, 10th into the 11th century. And now, again, 10th into the 11th century. Next up, we have al-Mishkawi. And Ibn Mishkawi is a thinker who really writes on a lot of topics, including psychology. And he's most well known for the topic of ethics, and how so much of medicine, psychology, the healing arts, if you don't have proper ethics in place, it all goes to waste, right? It all goes bad, essentially. And then he talks about how the need to control our emotions in order to develop traits to restrain ourselves from our faults, right? So really touching on, there is a way, this understanding, or this field of psychology, right? There's a way in which you learn how to have control over your emotions, right? And that helps you kind of correct faults in yourself. Now, the next person we're going to talk about, I could probably speak about the entire hour, entire lecture, which is Ibn Sina. And here Ibn Sina is at it's born at the very end of the 10th century and mostly lives in the 11th century, known as Abyssinia to the west, originally from Bukhara. And he is a philosopher and a physician, but he really, if you think about what Ibn Sina did, he contributed to all realms of science, if you will. Really one of these meta scholars or metaphysicians. And he writes about the mind, its existence, the mind-body relationship. So there goes that term again, just like Balkhi, right? Sensations, perceptions, in his very famous book, The Shifa, or The Healing. And Ibn Sina, as we say, people always say, he's one of these scholars who were able to link the physical and psychological illnesses together. He saw that there was a link between them and how it is that you treat them. So, for example, on the topic of depression, he says in his books, for example, that he believes or defines depression to be a mood disorder in which a patient could become, suspicious or develop certain types of phobias. And the anger, he says, essentially is a transition between this depression and between mania, is how he kind of the continuum of which he understands illnesses to fall on. And Ibn Sina, for lack of time, we're going to move forward, but do know that the canon of Ibn Sina, the Qanun, is a book used in European medical schools into the 1900s, right? So when people want to know the contributions of the early Muslim scholars, really, you don't have to look much further than Ibn Sina to understand the extent to which his book was taught in medical schools all the way through modern times. We have then next Al-Ghazali, Abu Hamid Muhammad al-Ghazali, so 11th into 12th century now. And if I could speak the whole lecture on Ibn Sina, then we could spend the whole week speaking about al-Ghazali, mashallah. MashaAllah, all the work that Imam al-Ghazali did. It says, we learn about al-Ghazali, that he is really considered to be the architect of later Islam, meaning what? The development of later Islam. That when they say that when Ghazali came, and one age of Islam came to an end and another one began. That he did so good in uniting all the fractionated opinions of his time into one kind of complete understanding that then moves forward into modern history. And Ghazali wrote, again, a meta scholar, wrote on so many different topics, but he really spends a lot of time talking about human nature and understanding the self, right? Discovery of the self, its ultimate purpose, the causes of its misery and happiness, right? He talks about four very important terms and how they are interrelated to each other. And again, we can spend a whole lecture just on this topic. But know that what Imam al-Ghazali talks about here, would really be the foundations of what we today would call Islamic psychology. He talks about the qalb, the ruh, the nafs, and the aql. The qalb meaning the heart, ruh, the soul, nafs, right, the self, and aql, the intellect, and how they all have a spiritual entity and how they're all interrelated to each other. And if I just took one of these four, if I just took the nafs and kind of explained to you what he does with all of this. For example, he splits the nafs into three categories based on the Quran. He talks about the nafs al-ammara, which you find in chapter 12, right? It says, and the nafs al-ammara is the one that exhorts you to freely indulge in gratifying passions and instigates you to evil, right? Al-ammara bis-su, right? So this is the lower nafs, if you will. There's also the nafs al-lawwama, which we find in chapter 75. And this is what today in modern understanding we'd call the conscience, right? That directs you towards right or wrong. It kind of stops you, the little voice in your head that kind of stops you from doing wrong or propels you to doing right. The nafs al-lawwama. Thirdly, he says the third category of nafs is also the nafs al-mutma'inna, which is explained comes in chapter 89 of the Quran. And here, this nafs is the self that reaches ultimate peace. So when he talks about the nafs in the three categories, right, he talks about the soul and the body, he likens it to the king in a kingdom. And then he says, he has got these great analogies. And for example, he'll say that the members of your body and faculties are like the artisans, right, the workers in the kingdom. The intellect is like the wise wazir, right, the wise advisor to the king. Desire is like the wicked servant. And anger is like the police that's in the city, in this kingdom. And he says if the king listens to the wise wazir, right, his wise advisor and counselor, he turns himself away from the wicked servant we said is desire, right? And he keeps the servant and the police in their proper places, then all the affairs of this kingdom will go right. MashaAllah. So that kind of gives you an idea of what he understood psychology to be and how these different parts all work together to have healthy mental health, if you will. MashaAllah. And for sake of time, we'll have to go to the next person. But again, Imam al-Ghazali, we can speak about for an entire week and his contributions in the field of mental health, of psychology, and certainly in all of the sciences of Islam, particularly the spiritual sciences. So we said Imam al-Ghazali was in um, the very end of the 11th century and into the 12th century, or in the 11th and into the 12th century. And now we find ourselves in the 12th century with Ibn al-Ayn Zarabi, who is originally from Sicily and then moves to Baghdad, where he's educated in medicine and the healing arts. And he becomes one of the very top physicians. But again, a metaphysician, not just known for medicine, but also known for astronomy, logic, mathematics, the natural sciences, right? Very much like the other scholars of our Islamic history, these meta scholars. And Azarabi has this really interesting understanding of mental health. And probably it's really important to note about him that every time he talks about mental illnesses, um, he never refers to the jinn, for example, or evil spirits in his discussions of mental illnesses. He remains very objective and very free of cultural influences, even of his time, right? And sees them as separate entities, as many of the other scholars do as well. And so that's actually really important when we talk about the historical roots of mental health as they relate to Islam. We don't have this confounding thing that happens with other thinkers and scholars where they're all kind of confused about where they confuse or confound, I should say, the two things. Rather, they're seen as separate entities, right? Like we talked about earlier, the endogenous and the internal and the external, the endogenous and exogenous, for example. And I think that's really important to keep in mind in the beginnings, the roots of mental health. And if we go to next up and last in our list, because there's many other points to discuss here, the second Razi, I refer to the earlier Razi, this is now the second Razi, Fakhruddin Razi, who is in the 12th century into the 13th century. And here, Razi is also a meta scholar who writes on many things, but probably a really interesting tidbit to know about Razi's writing is that when he talks about the human soul, the psyche, when he talks about human desire and needs, one of the main points he brings across is that human desires and needs are endless. So he says to satisfy them, by definition, is impossible. So what's important, instead of trying to constantly go after, constant improvement and constant fulfillment, rather the way to have the best mental health possible is really to abandon and avoid these desires, since you can't actually fully fulfill them anyway. Very interesting concepts here, mashallah. So again, the reason we talk about these early predecessors and their contributions is really to help us understand the depth and the breadth to which our noble predecessors spoke about what today would be classified psychology and psychiatry. And I say that it's one of the main things I really try to bring across in this research and the work that we're doing in the Stanford Muslims Mental Health Lab and in the Khalil Center is really trying to make sure that Muslims understand their own heritage, right? And understand that this concept of modern psychology and psychiatry, although it's seen and really, is seen as a Western construct or took hold in the West, the reality is its roots are very much from Islamic history and societies and thinkers and contributors. We have yet to really do the research to link everything point by point and where all these ideas came from modern. This work is just starting, and I'm going to share with you a little bit about my work on al-Balkhi. But it's so important to be able to do that, because until and unless Muslims do this, we're often going to just think about psychology as being really something that's not for us. It's from the West and of the West and not relevant to Muslims, but that's truly not the case. And so here I want to share with you, this concept of, let me first share with you, we talked about people, but now I want to share with you about institutions. And what I find really interesting about institutions, the hospitals and institutions of the Muslim world, you find that the first psychiatric ward in the world, right, within a hospital system is actually in the 8th century in Baghdad. And it's part of the Islamic hospital system. And it starts there and then becomes this mainstay feature of most Islamic hospitals from that time onwards. And you find that Islamic hospitals had a very strong emphasis on the importance of what today we would call the psychiatric milieu. The milieu is all the different components of treatment. Bathing, clean clothing, activities, visits for the patients, and so on. And that was very important in the original Islamic hospital systems. You also find that there are very novel treatments that are introduced, like music therapy or massage therapy. And this is in addition to medication and talk therapy, right? In addition to things that we otherwise would use, that today we would use and say, oh, that's actually how you treat mental illnesses. Well, in addition to, they had concoctions as well, right, for treatments. And they also had uh, practitioners. But what's interesting is these extra things that you don't typically think about, like the massage therapy or the music therapy, and even talk therapy, right? So when people say, what's the point of talk therapy? I can just talk to my friends or I can talk to my family. Why do I need to talk to strangers or professionals? Well, here's the answer why. This actually is part of your heritage as a Muslim. The talk therapy is um, very much part of the original Islamic heritage, as was of the hospital system, as was daily visits by physicians. Also, this idea of the interdisciplinary team. For example, at Stanford Hospital today, we really pride ourselves on the interdisciplinary treatment. When I was doing my training there, and I'm currently there as faculty, we really talk about this interdisciplinary team. But interesting to me is that one of my readings of early Islamic treatment in early Islamic medicine, we find the same things, particularly when we talk about the Islamic hospital system. You find the physician, the nurse, and often the nurses, by the way, were split into, there was usually the women's section of the hospital and the men's section, and there'd be women nurses and male nurses, mashallah, which are really interesting concepts. So the physician, the nurse, you'd have what today we would call the pharmacist or pharmacologist, who's the person who is dealing with the medicine, compounding the medicine, and actually putting it into practice, into treatment. So you have the three of them. In addition to that, you would have what today we would call the social worker, the person who helps you then figure out, after your discharge from the hospital, where you go next. SubhanAllah, right? How do you, once you're going to be discharged, then who's going to take care of you? Also, it's interesting to note that when the social worker person were to discharge somebody from the hospital, they would also give the patient at least 5 gold coins to then help them get back on their feet after leaving the hospital. Just a tidbit that's really interesting to me to read in the writings about the hospital system. MashaAllah. So the doctor, the nurse, the pharmacist, the social worker, they also would have the religious leader, right? The religious person who would come and do kind of tazkiyah, or helping spiritually the people get better. So imagine this interdisciplinary team, right? Imagine what that would look like if we had that instituted today. Beautiful, mashallah, really be able to pull all these people together for the treatment of one and each and every individual person. Then the really interesting thing to me, and is how all these services are paid for. Because maybe one of you are thinking, going through your mind saying, wait, that's great and all, but how is this being funded? Well, it turns out that all of the services in a mental health hospital, and even the general hospital system, but this continues to be true even in the standalone, what today we would call a standalone psychiatric institution, right, in the Muslim lands, was fully paid for by the Islamic government. That meant that anybody that had any amount of mental turbulence or illness was allowed full and free treatment in these institutions for the full duration of their illness, even if this was for life. And if you're thinking to yourself, well, how on earth was this funded? It's funded by the zakat, right? The obligatory yearly alms that is paid by Muslims, subhanAllah. That these are earmarked funds to then be used for certain categories of for certain categories. And yes, subhanAllah, they were actually used for to help pay for those who are in these psychiatric institutions in the Muslim land. This is really amazing and super forward thinking and um, incredibly precocious, if you will, for its time. And certainly something we've lost, and I really hope that we are able to institute and bring back. Also, it's important to know that Muslims really pioneered this concept of the moral treatment or humane treatment of the mentally ill. So as opposed to isolating, and certainly as opposed to what was happening at the same time, what I was just describing to you, kind of 7th to 13th century of Islamic era, the parallel that's happening in Europe at the same time is the Dark Ages, right? The Dark Ages. And there, people who are mentally ill, and this is well documented, were considered to be demonic, were considered to be witches, were even burned at the stake, right? At the same time that over in the Muslim lands, you have the Age of Enlightenment happening, and you have these amazingly clean and beautiful, actually even beautiful hospital systems for psychiatric institutions for the mentally ill. And I'm talking about fountains, water fountains, because the idea was if a mentally turbulent person could see water fountains and lush greenery and birds and so on, that they would quell and calm some of this mental turbulence. Look how forward thinking this was, subhanAllah, right? This is really powerful. And then, like we mentioned, all the rest of the interdisciplinary team, the humane treatment, the fact that this was paid for by zakat fully and completely. I mean, we're talking about not only did we have thinkers and thought leaders who really were forward thinking about mental health and illnesses, right? In the Enlightenment period of this, the golden ages, I should say, of this early Muslim history, but they also put their words into practice by having institutions that really then played out these very ideas. And if you're asking yourself why, how did all this happen? What was the catalyst? The catalyst clearly was Islam, and was clearly their understanding of what Islam had, the injunctions, these religious obligations or injunctions that came forward, like the ayah in the Quran that says, and do not give the property with which God has entrusted you to the insane, but feed them and clothe them with this property and speak kindly to them. That's very powerful, right? That's straight from the Quran. So the Muslim physicians and scholars that author these hundreds of books, right, and chapters and discussions on mental illnesses, their classifications, their managements, they really put this into practice in terms of the institutions. And I'm very, really proud of this. And I truly hope that, something like the Khalil Center is the beginnings of this work. And then, of practical implementation of what a Muslim counseling center and service would look like. And hopefully one day we'll have kind of residential or actual full-time hospital treatment facilities as well. Inshallah ta'ala. I promised you that in the midst of this discussion, I'd also present to you some really wonderful findings, which I think are also very powerful. This is some of my own personal research that came out of the Stanford Muslims and Mental Health Lab. And one of the lines of research, and I welcome you to check out the website. And if you go to med.stanford.edu and look for the Muslim Mental Health Lab, you'll find that in the lines of research that are looked through at the lab, that are researched in this lab, one of those lines is on the historical understandings of mental illness, which is where I'm deriving a lot of my talk today. One of my personal studies, and also from those in my lab that we work together on, looking at Imam al-Balkhi. Remember I said I really appreciate Abu Zayd al-Balkhi quite a bit, but I found that his work was incredibly novel and really precocious. I mean, well before his time. It was really well before his time. And like we mentioned about him, that he was from Khorasan, and he is an encyclopedic scholar that wasn't even well known for medicine, even, or psychology, but rather he was more well known for geography, subhanAllah. And the author of the book, The Sustenance of the Body and the Soul, which I do recommend you to have on your shelf. I think it's a very interesting book. And now that it's in English, it's a great resource. Small, tiny text, but super powerful in what it has in it, particularly considering that he is in the 9th century. And in the introduction to his book, the very first thing he says, he wastes no time in introduction saying, I'm writing this book for the modern, for the lay public. I'm writing it in a simple Arabic so that everybody can understand, and I am criticizing that my contemporaries, right, other physicians of my era and time, for ignoring psychological needs but only discussing physical needs. So I'm going to talk about the physical, which is, he calls his book The Body and the Soul, right? So half of his book is on body. I'm going to talk about the physical, but I'm also going to talk about the psychological. And he spends quite a bit of time doing that. And it's amazing the chapters he comes up with. So he has the 4 categories I had mentioned previously, right? We talks about anger, ghadab. He talks about depression and sadness, jaza. He talks about fears and phobia, faza. Um, and he talks about obsessional disorders or wasawis al-sadr. And these 4 categories, he has chapters on each and every one of these. And all of them are fascinating, and we have writings coming up on all of them. We've published on phobias and we've published on obsessions, both. And you're welcome to look at these articles. The one on phobias is found in the Journal of Anxiety Disorders, and the one on OCD or obsessions is found in the Journal of Affective Disorders. And there we talk about something that's really interesting. I was so fascinated, I mean, truly fascinated with al-Balkhi, and how when I came to the chapter on obsessions, I was just, I have to use the word here, dumbfounded. I mean, just completely taken aback by his entire chapter. I couldn't believe actually that this early on, 9th century, there would be a full chapter dedicated to OCD. Because when I look at what today we would call OCD, when I looked at and when you look at the history of psychiatry, the history of psychology, OCD is actually considered to be a modern illness. Modern meaning that it was more recently discovered than the others, classified, diagnosed, and discussed. And it's often attributed to a man named Richard Burton, who comes up with the very first case study about this. And then it's, which is like in the 1700s. But then you have the real discussion of OCD doesn't really come and fully manifested like a full classification and discussion of it until the 19th century. Now, when did I say Balkhi was? The 9th century. Sisters and brothers, we're not talking about a difference of a couple of centuries. We're talking about the difference of a millennium, 1,000 years or more of a difference. And what was so amazing to me, I was so amazed by this. I have to tell you the backstory here, is that when I went to my mentor at Stanford. This was still during my training, and one of the heads of OCD, our OCD clinic at Stanford, which by the way was one of the first OCD clinics in the country, and the head of it, who's now retired, was one of the foremost, if you will, forefathers of OCD in this country. And when I went to him and said, and by the way, I'll just spell out his name for you so that you can see here the qadr, fate as it's happening, right? His last name is spelled Koran, Dr. Quran, not Muslim, but so interesting that when I went to him and I said, Dr. Quran, I saw this chapter about OCD, and he said, and I said it's from the 9th century. He said, excuse me. I said, a full chapter on OCD in the 9th century. He said, no. I've looked at all the historical understandings of OCD, and I've written on this, and I've really researched this. I've never seen such a thing. And I said, Dr. Quran, it's in Arabic. He said, okay, well, how about translate it? And let's see what you come up with. Well, in translating it, I was really amazed to find that there were, that al-Balkhi's understanding of OCD, right, his understanding of obsessions, he puts them in you kind of make a list of them. And then I took out what today we would call the DSM-5. What today we use is the DSM-5, the Diagnostic Statistical Manual of Psychiatry. The DSM, the 5th version of it or edition of it was published in 2013. And this is what any psychiatrist would use to diagnose an illness. You have to meet these, a patient would have to meet these diagnoses, these criteria in order to receive a diagnosis. And it's standardized, and all psychiatrists across the nation use this. So I took al-Balkhi's criteria for OCD from the 9th century and put them side by side by the DSM-5's criteria of OCD published in 2013. And side by side. So if I were to read to you this, you will see how al-Balkhi meets it point by point. Point for point, he gets the criteria of OCD, and he's able to do this in the 9th century, subhanAllah, right? So for example, he'll say one of the criteria for obsessions is unreal thoughts that interfere with your ability to carry out different tasks. Well, in the DSM, it says recurrent or persistent thoughts experienced by intrusive or unwanted thoughts that carry and have marked anxiety or distress. Al-Balkhi says the person would be preoccupied with fearful thoughts. And the DSM said marked anxiety or distress. Balkhi says, person will try to resist these thoughts. And DSM will say that the individual attempts to ignore or suppress these thoughts. Yeah, Balkhi on the other side will say there are physical symptoms that come with this illness, right? They have a severe effect on the body. And the DSM-5 talks about these compulsions, which are repetitive behaviors, right? Physical symptoms that come. Al-Balkhi says that people who have obsessions usually expect bad things to happen. And DSM-5 will say that people will have a tendency to overestimate fear. Balkhi says that they are more likely to choose more complicated choices. DSM-5 says perfectionism, right? Balkhi says that people are very hard on themselves that have OCD. And DSM-5 says they have an inflated sense of responsibility. Point by point, point by point. I mean, we were talking about being completely dumbfounded. And when this presented to Dr. Karan, he said, immediately, this must be published. And again, I welcome you to take a look at this. And this, you can find this in the Journal of Affective Disorders. But what's really important and interesting is when you look then about al-Balkhi's treatments and the barriers to treatment, you'll realize that he's writing in the 9th century, but he could have been writing today. I would have written the same things as somebody who practices as a mental health practitioner today, right? For example, cultural beliefs about obsessions, right? There are all these beliefs about why these thoughts come. And maybe we don't need to seek treatment. Maybe we just need spiritual treatment because this might be from the jinn. Maybe it's because a person doesn't have very strong iman, right? Things of this nature. And so to that, Balkhi writes and says, look, even if these things are caused by jinn, or even if they're caused by shaitan, because a lot of people will say waswasa is caused by shaitan, and we believe that this is a real construct. He says, even so, you have to resist your negative thoughts and counter them with positive ones and actually seek out, he literally says, seek out mind-based therapy. Mind-based therapy. Remember, we said he's likely the first person to have come up with this idea of cognitive behavioral therapy. He's probably the very first CBT therapist in history, right? MashaAllah. Wallahu a'lam. Also, another barrier that he comes up with is attitudes towards seeking treatment. Attitudes towards seeking treatment. And so we say here, look, the attitudes towards seeking treatment, a lot of people are not willing to go get help because they say, I could just talk to my friends or I could talk to my family. Why go to a professional? He says, you go to a professional for physical illnesses, then you must go to the professional for mental illnesses as well. 9th century. He says that mental illnesses like physical illnesses must be treated with appropriate therapies by professionals. MashaAllah. And if people, and to the category of people where their barrier for treatment is loss of hope in finding any treatment or solution, he says, remember, he reminds his readers, remember that God created a treatment for every illness. And this comes straight from the hadith of the Prophet ﷺ, that for every illness that Allah sends down to humanity, he has also created its cure. Now that cure can come later in time. It's this knowledge that's given to humans. Like today, if we look at some of the illnesses that we have, we look at cancer and we say, look, there's still not a full cure for cancer, but certainly there's worldwide, there are researchers and physicians working on the treatment of cancer. Well, think about other illnesses that were so prevalent at the time, and there were no treatments then, but over time, God gave the inspiration for finding those treatments. So think about polio, which used to really devastate all of the world. Think about Even HIV, which is for those who are, who are old enough to remember the advent of HIV/AIDS, right? When it first came in, there was absolutely no treatment or cure at all. And now there are multiple treatments for this illness. And likewise, so when people feel, Al-Balkhi, here again, 9th century says, look, when you feel that there's a loss of hope, or if that's the barrier for you getting treatment, remember this hadith, that when God says and took it as an oath upon himself that for every illness that came down to mankind, there will also be a treatment that is eventually inspired, that he will inspire people to come up with as well. So don't lose hope. And that the aim of any treatment should really be cure and also prevention of the progression of that illness, right? So it's either this, a complete cure, and if it can't be completely cured, then at least preventing its progression. MashaAllah, super forward thinking. You also find with the Balkhi that he talks about internal and external therapy. Very, very modern thinking. He talks about how external therapy would be things like avoiding loneliness, staying occupied with your daily tasks and activities, taking a break and refreshing your senses every so often so you don't kind of get in the same rut and can't break out of it. In terms of internal therapy, he talks about fighting obsessive thoughts with positive ones, and reminding yourself the unreality of some of these fears, which is actually one of the main goals of modern cognitive behavioral therapy, or modern CBT, subhanAllah, right? And really being able to discuss these fears with a professional, be able to test out the reality of these fears. So again, super precocious and ahead of his time. If we look at really then what happens and the importance of people like Al-Balkhi, I will tell you that it's not just us as Muslims who this really is important for and reshapes our understanding and our of mental illness, but really this is something and that we should be proud of, but this is really something that rewrites the narrative of mental illness for all of humanity. When we talk about the Islamic roots of mental health, we're talking about others in here because in my place in my role as an MD, right, as a physician, as a psychiatrist, as somebody who is in academia, right, I'm at Stanford University, and as somebody who's right in the thick of academic medicine, it was incredibly important to me that this kind of knowledge, the roots of mental illness, the Islamic history and heritage as it relates to mental illness was understood not just by Muslims, that too, but really by all people. And for my field, by academic medicine as well. So the very first thing we did with this work is we actually chose to publish it. But for those who are familiar with publishing in medical journals, it's really difficult, right? It's a peer-reviewed, double-blinded effort. And it was not clear whether people would take to this. Here we are, literally saying that, something like OCD was not first talked about and fully classified in the 1900s, in the 19th century, but rather in the 9th century, and not by a European scholar, but rather by a Muslim scholar in the 9th century. So talk about like really rewriting history here. And to show you, I don't have time to go through I shared with you a little bit about Al-Balkhi and his amazing understanding of what today we would call OCD. But he did the same thing with the concept of phobias, and we have another paper completely on that. But just to share with you, when the reviewers of the paper, when we submitted to the Journal of Anxiety Disorders, it took them like a couple of months to finally get back to us, to a point that I said to my team of researchers, I said, I'm not sure that this is going to go over very well. Here we are trying to like rewrite medical history. I'm not too sure this is going to be accepted by the general medical community. But they actually finally wrote back to us a few months later and said, look, we apologize for taking so much time. The reason we took so much time is because what you brought forth here really rewrites history. And so we wanted to find people who were, who had backgrounds in medical history, who are historians, right, in medical history, and are able to really verify what you're saying here. So it took them some time, and they found these folks, and I'm just going to read to you a couple of lines from some of the reviewers' comments that they wrote back in regards to our paper on phobia and Balkhi from the 9th century. So in addition to saying, this is a very interesting contribution to the history of psychiatry and to anxiety disorders in particular, there is, it addresses two very perennial questions in our field. First, to what extent do DSM disorders travel across cultural boundaries? And to what extent are they trans-historical? And for specific phobias, which is what our paper was about, the article's work provides an affirmative answer to both. And it's that her exposition of al-Balkhi's work overturns the view of one of our most distinguished historians of psychiatry, Berrios, by showing that phobias had in fact been a focus of medical attention long before the 19th century, at least in the Islamic world. And she shows that phobias were interpretable in non-supernatural ways during the Islamic Golden Age, which is actually a very important point too. Again, that there was understood that there is a spiritual aspect, but also there is a non-supernatural understanding of what exactly these illnesses entailed, right? A medical or biological explanation, basically. Moreover, that the method of graduated exposure in vivo is clearly described by al-Balkhi in ways instantly recognizable to behavior therapists today. So those are people who are historians of medicine writing these comments. So this really excites me because not only is it a breakthrough for our Muslim community, but it is a breakthrough for the general medical community and certainly for the psychological and psychiatric community as well, practitioners to really understand the roots of mental health and how they came from the Muslim world, many of which came from the Muslim world. This is very important, I think, and one of the main things that I want to emphasize upon you in this discussion. In the last 10 minutes or so of our discussion here, a few minutes of our discussion here, I really am going to wrap up by saying and kind of discussing some of the current challenges I believe we have in relation to Muslims and mental health, and as people who really want to do something about this, and try to outline some of the solutions or steps that I think would be very important. First, I would say one of our first challenges is that modern psychology, and I know you might have heard this whole lecture and said, okay, that's all great and fine, but how does that relate to modern psychology? I mean, can I just go to a psychologist today and they're going to know about al-Balkhi? And the answer is probably not, right? So really one of the current challenges of modern psychology is that elimination of metaphysical elements, right, from natural and human sciences. Essentially, gross sacralization of the discussion of psychology, right, and neglecting moral and spiritual phenomenon, and saying that people, religion is private or individual, and it has nothing to do with the psyche over here and our discussion in a secular term. That's very unfortunate. And it's again not just Muslims that are recognizing this, but also people of other faith traditions that are God-centered in their approach of the understanding of the world and the universe around them, and making sure that God stays in the picture and right front and center, right? So the secularization of the social sciences really led then to development of theories that leave very little room for human volition. But this is contrary to Islamic theory of human nature that says that there is substantial room for free will, right? The ability to be able to change things. And that's very important. Another one of our main challenges is Muslim psychologists or Muslim psychotherapists or Muslim psychiatrists who are trained in secular education and only have secular education. So they're not trained and not rooted themselves in the Islamic sciences, yet they're Muslim by faith or culture or being born Muslim. And they are wholly under the influence of the scientific frame of mind and embrace Western psychology as it is without actually thinking through it or criticizing it or seeing that there's other facets of it, and are also not grounded in the Islamic sciences themselves. So then what happens is you find them kind of speaking and offering, they are Muslim, but they are offering offering modern psychology to Muslims without really any depth of understanding of Islam or the roots of mental health, Islamic roots of mental health. And this is quite a problem, I would say. So what needs to happen then is a serious challenge, right? Because if you're grounded only in the secular worldview, and we understand as Muslims that you can't just sort of take psychology as it is, right? You need to be able to piece it apart and take from it what's useful to the Muslim and leave behind what isn't, right? There are theories and concepts and ideas that are not useful to the Muslim. So then what happens in that case? Well, in that case, you can't actually do that without proper Islamic training and understanding. Again, one of the main reasons why we have the Khalil Center and why we insist that not only are all our counselors and practitioners um, fully licensed in psychology, psychiatry, marriage, family therapy, and social work, and so on, but in addition are being trained in techniques of Islamic psychotherapy and are being rooted and trained in Islamic sciences, right? That way they're really able to take what's good and throw away what's bad of modern psychology. Furthermore, we would say there really needs to be this Islamic perspective on the theoretical and the practical and the bringing back of our own indigenous psychology, right? So with that, on a theoretical level, what that means, what it really boils down to, is being able to identify and clarify our worldview in terms of knowledge and understanding, of nature, human nature, and the purpose of knowledge, and so on. Also clarifying our Muslim core beliefs and understanding the distinction between secularism and Islam. Really being able to define, or I should say redefine, the subject matters of psychology from a very Tawheed-based paradigm, right? A God-centered paradigm. So taking the nafs, or the soul, and re-looking at it completely from an Islamic religious perspective, right? Taking then and developing, or I should say expanding, theoretical framework of all topics that are within the realm of Islamic psychology, just like our noble predecessors. And in a very practical level, what this means and what we've been doing in our lab, we've actually looked at over 125 manuscripts from this historical era at this time. And it means that you're going to have to take, you translate works from Arabic and Persian and Turkish and Urdu, right? And you're also going to have to look at even um, modern psychology writings from the Muslim lands as well. That might be in English, that might be in French, that might be in these other languages as well, to be able to really put them in appropriate languages that the modern Muslim can understand and use, right? And I would say that this would mean that there has to be, hopefully, university grants, endowments, private funders that comes and support this effort financially, because it is a broad and a large amount of work. And it really will require a network of psychologists throughout the world that really will cooperate in this venture. And I'm happy and proud to say that the work has started in the Muslims and Mental Health Lab that we have at Stanford. And we certainly welcome these contributions and collaborations, but we will eventually have to put our money where our mouth is, right? And be able to fund these projects and have funders that are willing to fund these kind of projects to make sure we can have something called Islamic psychology or Islamic psychotherapy that really is relevant to the modern day Muslim. Lastly, I would say, again, what we do with the Khalil Center is training our Muslim psychologists in Islam itself, right? And then teaching Islamic psychology in its very comprehensive manner. And in order to then help with the general population, we also need to develop standardized scales for Muslim populations. I'm happy to again say this is another one of the lines of research that happened through the Muslims and Mental Health Lab, standardized scales, because so many of the scales, whether it's on depression or anxiety or so on, that's given today in a psychiatric or psychology a therapist office, are for the general population or are not relevant so much to Muslims. They're not very, Muslims have very unique needs or understandings that you really need to make sure it's adapted for. So that's another field that has to be robustly worked on, and empirical studies of Islamic ways of actually dealing with psychological problems, addressing crisis within families or schools or marriages or so on. So inshallah, this is the goal of the Muslims and Mental Health Lab at Stanford, and also, which is on the theoretical lens and on the research arm of the Khalil Center. Then there's the practical part of the Khalil Center, which really then takes all of this theoretical knowledge and tries to and works on implementing it, training all the up and coming therapists and psychologists who are Muslims working with Muslims, and then training, kind of doing these training seminars, both for the clinicians, but also for the general population, and also for our imams, our religious leaders, and community leaders, both male and female, And so, inshallah, these are all efforts that are up and coming, but definitely and absolutely affect the work that we're doing. And all of it goes back to, and which is why we start the month with the discussion of the Islamic roots of mental health. Inshallah, I hope this was a useful introduction, and that's really all it was here. There's so much more that we could have said, and so many more people that I would like to credit and speak about. But here I really want to say that this is just a taster, just kind of a beginning discussion of the Islamic roots of mental health. And I welcome you again to visit the Khalil Center site and to visit the Stanford Muslims and Mental Health site. And certainly, if you'd like to collaborate with us, to let us know. And in all cases, definitely keep us in your du'as. And I hope this is an enlightening discussion that then lifts up the Muslim community and really helps them understand their own heritage and their own roots as it relates to mental health. Signing off, this is Dr. Rania Awad from Stanford, and the director of the Muslims and Mental Health Lab and the clinical director of the Bay Area branch of the Khalil Center. I ask for your du'as, and we'll see you soon, inshallah. Thank you again to ISNA for collaborating with Khalil Center and for really being on the forefront of mental health awareness for Mental Health Awareness Month. Barakallah fikum. Signing off, Dr. Rania Awad. Assalamu alaikum wa rahmatullahi wa barakatuh.